Hello, and welcome to your preoperative visit with the bariatric surgeon. During this visit, we will go over the specifics of surgery. This educational video will emphasize important aspects of surgery and the surgical process. Please be prepared to review your health history with the bariatric coordinator. Alert us of any changes in medications or in general health since your initial visit. Please discuss with us any bleeding disorders or issues with anesthesia. This includes yourself or your family. We will provide you with a copy of the lab work you previously completed with our program. Please keep these labs as a baseline. We recommend having these labs rechecked by your primary care physician around 6 to 8 months post-operative. This will help identify changes that have occurred following surgery. One of the quality initiatives we have as a program is improvement in lung function prior to surgery. We do this by providing you with an incentive spirometer, which helps prevent pneumonia. This short video will go over how to use this device.
The incentive spirometer is designed to open up small airways in your lungs that can become narrowed and inflamed, which can lead to post-op pneumonia. It is a 3-step process. Step 1. Gently blow into the mouthpiece and squeeze the air out. Step 2. Inhale back through the mouthpiece at a rate that will keep the small float on the right in between the 2 arrows till the lungs are full. The large float in the column will go up. Step 3. Hold that breath tightly for 5 seconds. We prefer 6 breaths an hour while awake, at home, and resting. Do not attempt 2 or 3 deep breaths in a row. Allow a minute or 2 between breaths to keep from getting dizzy. Bring the incentive spirometer into the hospital so it can be used again post-op. Also, if you use a CPAP machine at night for sleep apnea, bring that with you to the hospital as well.
Please use your incentive spirometer daily during the 2-week pre-op diet. You will complete 10 breaths in the morning and 10 breaths at night. Bring your incentive spirometer with you to the hospital. Complete 10 breaths per hour while you are awake in the hospital. You do not need to wait for the nurses to tell you to use it. Once we set your surgery date, we will backtrack 2 weeks from that date to determine the start for the preoperative diet. This diet is low to no carbohydrates and helps to shrink the liver. This makes surgery safe and easy. Specifics of this diet are on page 25 of your program manual. Call the dietitian with any questions you may have. Our quality coordinator will discuss the specifics of the pre-assessment appointment with you. During this appointment, you will meet with nurses and an anesthesiologist to ensure that you are ready for surgery. Please bring all your medications in original bottles, your insurance card, and your driver's license to this appointment. Any financial obligation to the hospital will be discussed during this time. Remember, nothing to eat or drink on the day of surgery. You will arrive about 2 hours prior to surgery. If you have sleep apnea, please bring your CPAP machine to use in the hospital. All our surgeries and hospital stays take place at St. Francis Eastside. Surgery typically takes anywhere from 1 to 2 hours. During surgery, our surgeons will look for any hiatal hernias and fix them at this time. As discussed previously, the risks of surgery include anesthesia, bleeding, and infections. Risks specific to bariatric surgery include leaks, death, and bleeding requiring transfusion. We pride ourselves on being a practice with a low complication rate and do our best to keep you safe at all times. Following surgery, you'll be transferred to a room on the 3rd floor at St. Francis Eastside. You will have pain and nausea medication as needed. Please ask for any of these medications if you are having any pain or nausea. Post-surgery, you will have ice chips, but no liquids. It is mandatory that you are out of bed and walking 4 hours post-surgery. You should also be using your incentive spirometer 10 times per hour while awake. The morning following surgery, you will go to radiology to complete a swallow study. Following review of this study by your surgeon, the catheter will be removed. You will also be progressed to a liquid diet and will be allowed to shower. Your meal trays with a liquid diet will have many different items. You are not required or expected to finish your tray. You will not receive protein supplements in the hospital. You will start those when you go home. You will continue to have IV fluids in the hospital until discharge. We expect you to continue to use your incentive spirometer, be out of bed walking, and sipping liquids during the day. Remember to rest as needed. While sipping on liquids or eating, you should be sitting upright in a chair or upright on the side of the bed. Do not drink or eat while lying down. You will not use straws, and we recommend small, slow sips. When taking medication, remember to take one pill at a time. You will likely be discharged from the hospital on post-op day 2. At discharge, you will be given prescriptions for pain medication and a follow-up appointment for our office. You will receive instructions on which medications to resume, start, or discontinue. Your goals for the next week are drinking 64 ounces of fluid per day, consuming 60 grams of protein per day, and staying active. Activity can be walking, using the elliptical, or taking the stairs. Remember, no driving if you are taking any pain medication. Also, no lifting greater than 20 pounds and no strain on the core, including twisting and crunching. There will be no swimming or baths in the first 3 weeks. You will see the surgeon and surgical weight loss team at frequent intervals in the first year post-surgery. These visits are typically at 1 week, 3 weeks, 6 weeks, 3 months, 6 months, 1 year, 18 months, and 2 years. Our team follows you for life, and we want to see you yearly, even years down the line. At your post-op visits, you will typically see the dietitian as well as the surgeon. During those visits, we will ensure that you are meeting your nutrition and exercise goals. We will progress your diet throughout the first few visits. Remember, it takes individuals varying times to adjust to a normal diet following surgery. It can take anywhere from 3 weeks to 3 months. A few other reminders and considerations. If you are experiencing nausea or vomiting post-surgery, make sure you slow down when eating and drinking. Make sure you're chewing well and sitting upright during meals. Do not eat and drink at the same time. If you are experiencing nausea or vomiting 3 or more times per day, please call our office. It is normal to experience some taste or smell changes following surgery. Try a variety of foods and fluids to see what works best for you so you can meet your needs. Some constipation and/or diarrhea is normal as your body is adjusting and healing. If you are having watery diarrhea 4 or more times per day, please call our office. Do not take any anti-diarrheal medication. We have now gone over the process for pre-surgery, surgery, and post-surgery. Please ask our bariatric team any questions that you may have. Pending final approval from the surgeon, you will speak with our quality coordinator and set a surgery date. Reminder, if you should become sick before surgery with fever or chills, please call our office immediately to reschedule surgery. This is very important for the safety of yourself and our team. Thank you for your time, and we look forward to working with you. One of our team members will be with you shortly.